So hello dear long haulers, here's Bohumil again from Mulheim an der Ruhr. I don't know if I spell it right. So I'm making this video because I want to and because I promised to long haul community. I'm around a little bit more than 24 hours from the first help apheresis treatment for long COVID. So I have many questions from you because I posted on the Facebook on the apheresis Facebook group that you can answer me anything you want, and I will answer them right now. So I want to apologize if I spell the names wrong, because sometimes it's for me a little bit difficult. So I think one of the biggest or greatest questions is from Sarah Worley, because when I answer her, I will answer many other questions. And she asked me, I would love a step-by-step of any tests and procedure, any medications involved, and so on. And how are you feeling now? How long it lasted? How comfortable, painful was it? Thank you so much for sharing your experience. Thank you very much, Sarah, for this answer. So I went to a clinic. Let's get straight to the point. And there are many wonderful people, many wonderful nurses who are very nice, and Dr. Jäger, which is great doctor. I will get to that. You sign some papers, just the basic stuff that you agree with. There will be some blood tests, the apheresis will be done on you, nothing like strange, everything you would expect it. After that, I a little bit waited and talked directly with Dr. Jäger. Please let me stop here immediately, because I want to thank her very much and her team, her wonderful team, because she's very kind human being. She's trying to help us. She must have lots of work, and so I spoke with her. It was very wonderful conversation. I told her my symptoms. I will a little bit repeat them. My biggest symptom right now, which is bothering me like hell of me, is the head pressure in the brainstem area, which is coming from this area to these temples, to this side of the head. And it's not just about the head pressure, it's about it, makes me hard to concentrate, to think, and my brain is like, how to say it, like old system. It doesn't work properly. So this is my biggest symptom. So she told me that many, people from all around the world are traveling for help apheresis, because one of them, not so many, but one of the couple theories why long COVID is happening is because of the microclots in your blood. And because of the microclots in your blood, the blood cannot deliver the oxygen into the organs, into the right places, and that's the reason why all those symptoms we know, many of those symptoms we know, are happening. And the help apheresis is probably the most successful treatment how to get those microclots, not just microclots, but the other stuff, the bad stuff, from your body. So I told her my symptoms, and the biggest relief is when you, after many experience from the other doctors in my country, and I think your experience from your countries too, she believed me. That's a great, when somebody, because she's treating long COVID patients, like just one of few doctors all around the world. So she believed your symptoms. That's a great relief. And she told me, that it seems like everything is just the microclots. So and after that, I went upstairs when the long apheresis was done. I will a little bit speak about the procedure. So, because many questions, is it painful? How long does it last? And I will answer that. It's not painful. Just a little bit the beginning, but nothing like very, very painful. They just must put needles in your left arm, in your right arm, in both of your arms. There are some tubes where the blood is running, and you are connected to the help apheresis machine, which looks like some kind of robot. There's lots of filters and lots of tubes and all the stuff. So it's not painful. It took me around 3 hours from the start to the end of the procedure, because they'll filter many liters of the blood from your body. So it's easy, you can listen to your iPad or something you want in the earphones, because the nurses are very great and they care about you if everything is done right, if you need something to drink and anything else. I mean, the stuff is great. So it's like about the procedure. Somebody asked me what's the, I put it some photos on the group so you can see it better. The Apheresis machine, and there's a white yellow stuff in the filter, and somebody asked me of you guys what's the yellowish stuff, and the yellowish stuff is your plasma from your body. And on the bottom of the picture, on the bottom there's like the thumb, you can see the bad plasma, which is filtered out of your body. It should be, they tell me, it should be like the fibrin, I don't know what's the correct answer for that, word for that, and the bad stuff which is coming out of your body. So it is the yellowish stuff. So the procedure was very easy. There are many questions. I mean, answer that. Did they do any tests on you before the treatment? Yeah, they did. They took blood out of my veins for the tests before the procedure. They took my blood directly after I ended, and they took my blood, today in the morning, because they want to check it, how is it before, directly after the procedure, and like many hours after that, how the blood changed because of the apheresis treatment. So blood tests and many other tests, because I want to tell you there's the team from South Africa who is interested in the blood clots, who examine them. It's the doctor, I don't know if I pronounce it well, Dr. Pietris team, and she uses special microscope which she looks directly into the blood and is checking for the microclots. So I think this is only one way how can you see them. She check out her on Twitter, because today she signed a post on Twitter where was written how he's checking it. So I will put it under the video, you guys can see it. So, and many other tests, because there was like a walking test. I walked from one end of the room to another. There's a fingerprint test. You just put ink, your this finger into the ink and put it on the paper. That a little bit surprised me, because they told me that some of the long haulers lose their fingerprints. Well, I don't have these symptoms. Unlucky me, because you could have like a great career as a thief if you lose your fingertips. Just kidding. There was, of course, blood pressure test. They took my blood pressure when I was lying down and when I stand up. So after that, they took my blood pressure again, because because of the dysautonomia, because of the POTS symptoms and the orthostatic hypotension symptoms, which are very common in long COVID and after the COVID infection. So blood pressure test. Before I flew to Mannheim, I did a cognitive test on the computer, where it's like you have to match the numbers, like from I don't know 1 to 4, at least to 40, and they are all over the screen, and you must to put them in the correct order, and those little simple cognitive testing. So blood pressure, cognitive testing, walking test, many blood tests were done, and of course I forgot, very important, by Dr. Khan, I'm sorry about the names, who is here. He is a long hauler himself. I think you know him from the other YouTube videos. He did the spirometry test, the lung test, when you have a tube, you take a deep breath and you breathe out and breathe in. So they are checking before the apheresis and after the apheresis. And this is, I think it's very interesting. After the apheresis, my spirometry was a little bit better than before I had it, because they think because they filter out the microclots, the breathing gets better. You know, the change, oxygen change between your lungs and your blood gets better. Yeah, so that was very interesting. So that's all I think tests I had before the treatment, and after that I told you. So I will get to other questions. Hey, what did they say about your blood plasma? How did it look in their opinion after the first treatment? I don't know what's the word in English for that, but the guy who take care of me, who did the machine, who put me on the machine, very nice guy. He told me that it looks bad, that there's so many like the bad stuff in the plasma. So that was their opinion after the first treatment. Did I use numbing cream? What symptoms do you have left? I still have the bad head pressure. It's probably my biggest symptom. Numbing cream. To be honest, I am not sure because everything was very, new to me and my mind was all around the place. I'm not sure if there's a numbing cream. They use, of course, some disinfection on your arms. I don't know about the numbing cream, but it doesn't hurt. It doesn't hurt a lot. How do you feel? Yeah, to be honest, I'm sorry. I feel very, very tired because after this procedure, they told me the other day, directly after that, you feel like energetic a little bit more. Yeah, you feel like light. But today, after that, you feel very tired. So I recommend anybody who will have this treatment in the future to rest. Really rest. Don't push yourself because it's not easy procedure for the body. It's not like some Röntgen or CT or MRI when you are just lying and sleeping. Yes, do you feel better? To be honest, I still have the same symptom right now. So I think it's very, very too early to say if just the one treatment was helpful or not. So I feel like okay. I'm still glad I came here because it was a little bit hard to get here with all these restrictions. Yeah, I forgot when you are on the apheresis, they put heparin in your blood. I think you know that, guys. How do you decide how many treatments you are going to need? This is like a little bit tricky questions because everyone is different, guys. You know it. Every longor has a little bit different symptoms. So Dr. Jaeger directly told me that there are many patients who are getting much better or healthy after just one treatment. It can happen. Sometimes you need 4. Sometimes I think the biggest number I read, some guy needed like 14. So this is very, very individual. It's very hard. But I think the starting point is when you can decide if it's working or not. It was told me that you need like 3 or 4 procedures to tell if is you getting better or not. So the 4 treatments, I think it's like the magic number, but it's a very individual. It's difficult to answer that. Any questions? Did your blast? Yeah, what's the thing you holding in your arm? You can see it on the picture. They give you the blue, what's that? It looks like balloon. You sometimes have to squeeze it because it helps the blood run through your arm. I forgot to squeeze it for a long period of time, and the blood wasn't running, so we just squeeze it a little bit more, and the blood start to running. So that's the reason why you have it. How did you get into program? You just have to register on the website. I think you can find it on the group, on the Apheresis group. You are put on the waiting list and they contact you. So I get here on Mulheim because I just registered on the waiting list, and when was my time, they write me an email. We have a slot for you, do this, do that, and That's the way how I'll get there. Here. Did you have POTS tachycardia on standing, and has this helped that? To be honest, don't have POTS, but I have orthostatic in hypotension, which is a little bit similar. The symptoms are similar. So after the first, it was much worse months ago. I couldn't even walk. It was very hard for me to walk. I have to, like lean, lean on the wall when I was getting to the toilet. So it improved with many treatment, which I done with the vitamins, the magic pill, and many others. And I think it's getting better. That my blood doesn't feel like it's still inside my legs when I'm standing. So I feel it more like in my upper area now. So yeah, it's getting better with the time, maybe with the vitamins, and I think help apheresis will help that too. Is it necessary to take medicines while you are taking this treatment? How long? Good luck. I think there's, Marcus put many protocols you can do before you reach Mulheim or any other clinic for apheresis treatment. I think you can find it in the on the our apheresis Facebook page. I think it should, it pointing to decrease the viral load in your body, like the spike protein and all this stuff. And so I use that, and I take aspirin, it's recommended right now. So other questions. Do you know now that you have microcuts? Not yet, but they will tell me later, because there are many long haulers, many blood samples, and it's couple of people, so they're working long hours. So not now, but they promised me they will tell me if they found it in my blood. But I can tell you, because I asked Dr. Jäger if I can speak about this. They see in many long haulers those microclots. In many long haulers who come to Mulheim to do the help apheresis, they can find microclots. So I expect that. We'll see. This was a funny question. Do you prefer Mars bars or Snickers? Snickers all the way, my friend. Outside the clinic, can you get around okay given everything is in Germany? Where are you staying? Do you drivers speak English? I'm staying in the apartment. It's a flat here in Mulheim. It's like, I don't know, less than 15 minutes by walking from the clinic. Yeah, in Germany, of course, you can get everything. There's like a Lidl close to our place, so you can buy all your food. Do Uber drivers speak English? I have only, I do now everything by walking because I'm close to the clinic. And I had a transport from Düsseldorf, where's the airport. It's like, I don't know, 20 minutes from Mulheim. And the driver spoke, was a very, very funny guy, and he helped us English very good, so it was no problem. I don't know about local Uber drivers, my friend. I didn't use them now. Is there any effect on your head as far as brain fog or pain? I don't feel headache, like the pain, but I still, when I'm standing, longer I'm standing, the brain fog gets worse and worse. So there's still no effect, but it's very early. I have just one treatment and it's still very early. So I a little bit feel still the same. How many Pris Whale? Hello Pris. You are one of the favorite long haulers. How many treatments are you planning? To be honest, I hope I will get at least three, because two more from now. I will be staying here till the end of this month. After that, I will probably have to fly back, to Czech Republic, if they allow me. Any other questions? How frequent is the treatment given? This is like very individual. When you are here, they are trying to, do much treatment as possible, but it's like not so easy treatment, for your body. I think I read it should be like at least 96 hours before one and another, because the body must I like to say it, regenerate after one treatment. So it's like 96 hours at least. But it depends how you feel after the first treatment. So it's a very, very individual too. Is help apheresis effect to treat Lyme? I'm sorry, I don't know. I read it. They use it for like those post-viral symptoms, and Lyme is one of them. But sorry, I think I can't speak of this because I don't know. But I read somewhere they use it for Lyme, so it's worth to try. So another questions. How do you decide how many treatments you are going to need? I will see, I think, after the treatment. And if they told me they found microclots in my blood, that would be, in my situation, it would be great because, I have something to catch on. So if they find microclots, I will probably do more because how you can get rid of them. I know there's some medicine, like supplements, like I don't know how to say it in English, natokines, lubricanase, aspirin, separatose. They are bought by many longhorns to get rid of the clots. You can get them. They are a little bit pricier, some of them, but you can get them without the medical prescription. Yeah, who told you which medicines to take and how did you get them? I will probably answer this in another video because I don't know if I'm allowed to speak. Maybe I am. I have a prescription for medicine by Dr. Jäger herself. She gave it me on the clinic. I have to pick up the medicine in the local pharmacy. It should help, like, thin the blood and make the clots go away. So, any other questions? Let me check. Yeah, I will show you something. I will find it on my mobile phone. It will be very interesting. I hope you will see it, guys. And it's my blood measurement. I don't know if you can see it. I hope you can see it. No, it's a little too light. Maybe like this. Sorry about this. I hope you can see it. I will put it here a little bit longer. I know it's a little bit glassy, and this is before the apheresis, and this is after. I don't know if you will be able to see it. And there's one important, like a measurement, which is my SO2, which I think is like a oxygen in the blood. I hope I say it directly. Before the apheresis was 59.9, yeah, which I heard is very common in long haulers, this number to have low. And after the apheresis, this SO2 was 82.5. So before it was 59.9. After it was 82.5. So much better. I hope it shows something. So I don't know. I hope I answer many of your questions. When I will have the second treatment, I was at the clinic today and they will call me for the second appointment. I hope this week. I guess I will be getting it probably next week after the weekend. So guys, I want to help. There was a question if I met any other long haulers on the help apheresis. Yes, I did. Many wonderful young people around my age. I think they were around like 30 to 40, between this age. Many smart guys, many smart people. There was one doctor from UK, very smart guy, who had the apheresis in the same time when I had it. One guy from Berlin, very smart guy too. I think he was a journalist who had this treatment too. And it was interesting, the conversation between these two and me, because the doctor, Dr. Merrick, I hope he doesn't mind, I will speak his name here, was very interesting to listening his experience, especially as a doctor. So I met many long hairs, and the stories, guys, you know, are very similar between us, so you know it directly. So I met them. So I will just check if I didn't miss any important questions. I'm sorry, I'm a little bit tired, you know, and the COVID brain doesn't work, so I hope it's not too much chaotic video. There's a good news, you could read it probably on the Apheresis team. More free slots coming in from 2 more new clinics, so check your email, guys. Maybe your chance to get to Apheresis will be earlier than you thought. So sorry, I will want to answer all questions. Do you have any pains? I have very bad pains in my toes, which seems to blood flow related, and feel like the same pressure in my head. I have bad head pressure and pulsing. I will be interested to know if you had any feet blood flow issues as well. Head problems. I had head problems, I told you. What doctor says about the pressure? Yeah, what the doctor says about the head pressure is very interesting, because, you know, I don't know if you read it, it affects the brainstem. Probably that's the reason the microcuts can affect, you know, the brainstem, and the brainstem is like center of everything. You know, you have the like the breathing center here, and the center which I think controls the heart rate, and all this stuff your body does automatic. You don't think about it until, you know, it's broken, like happened in our cases. So I think it's the maybe the effect of the brainstem. But, you know, that should be it. Guys, I hope I answered everything. I'm sorry it was a little bit chaotic. Maybe I will make another video after the second treatment. If I forget everything and you are interested sorry, in another questions, please ask me under this video. I will answer them by writing. So guys, this is Bohmel. That's all from Mulheim right now, and please stay strong. See you.